SIBO has become one of the most popular search terms on Google in the last 10 years, and now everyone and their grandma either knows what it is or has had it themselves.
I get it already. It's bacterial overgrowth in your small intestine. What else?
Yeah, but what actually causes SIBO?
I don't know.
Pay attention to what I'm about to tell you if you want to mitigate your risk for either developing SIBO in the first place or experiencing a relapse, which happens in upwards of 45% of patients following antibiotic therapy, and that's just in the first year. Number 1. Low stomach acid and digestive enzyme production. Stomach acid not only helps in breaking down food, but also in killing harmful bacteria and other pathogens that are ingested with your food. Similarly, digestive enzymes play a crucial role in breaking down food into molecules that can be easily absorbed for nutrition. When there's a deficiency in either stomach acid or digestive enzymes, the food remains partially digested and lingers in the gut. And this creates a perfect environment for bacterial overgrowth. So what can you do about it? Don't eat undercooked foods.
It's raw.
Chew your food well. Make sure that your stomach acid levels are within normal range and that your enzyme production capabilities are on point. Number 2, slow gut motility. Gut motility refers to the speed by which food and waste travels through your digestive tract. As the majority of your gut bacteria reside in the large intestine, people who are constipated or don't have regular bowel movements are at greater risk for developing SIBO. This is because the bacteria in the large intestine can move backwards into the small intestine. So if you do have this kind of issue, what are some things that you can do? Honestly, I can make 10 videos on motility alone because everyone's reason for why their motility is impaired can be different. But here are some good general rules of thumb. Drink plenty of water, exercise regularly, have a quality magnesium supplement, and also consider supplementing with insoluble fiber like cellulose and lignin, as these things can help regulate motility for the long term without the risk of developing dependency. Number 3, ileocecal valve dysfunction. The ileocecal valve is a valve at the junction of the large intestine and the small intestine. It opens to allow digested food to pass from the small intestine to the large intestine, where water will then be reabsorbed and eventually the contents will be turned into stool. However, in some people, the ileocecal valve can remain open for extended periods of time, leading to symptoms such as diarrhea. And in others, it can remain closed for extended periods of time, leading to bloating, constipation, and you said it, small intestinal bacterial overgrowth. So one thing you can do is regularly stimulate the ileocecal valve by taking your fingers and deeply massaging the abdomen where it is located, and this will help regulate its function. The valve can be found halfway between the belly button and the right hip bone. Using your fingertips, apply gentle pressure and make small circular motions. The pressure should be firm but not painful. Feel like you have to go to the bathroom yet?
Do you like it? You taking a shit?
Number 4, intestinal dysbiosis. Dysbiosis refers to an imbalance in the microbial populations of the gut, where the harmful bacteria outnumber the good bacteria. This imbalance can result from various factors such as poor dietary habits, chronic GI issues, or excessive antibiotic use. And this actually creates a challenge in the recurrence of SIBO, as the main course of treatment for SIBO involves antibiotics. However, antibiotics can also then lead to intestinal dysbiosis, and then we do it all over again when SIBO returns. This is why I favor using an herbal approach to treating SIBO, which in some studies have shown to be as effective as antibiotics and are less harmful to the gut microbiome. Number 5, poor immune system health. The immune system is highly involved in maintaining bacterial balance and fighting off infection. And so a poor immune system can lead to intestinal dysbiosis, which we just covered. This weakening can occur due to a variety of factors, including chronic stress, inadequate sleep, poor nutrition, or other underlying health conditions. For instance, chronic stress can lead to the production of stress hormones like cortisol, which, when persistently elevated over time, can suppress the immune system. Similarly, lack of sleep disrupts the production of protective cytokines and can reduce the activity of immune cells like T cells. Immune system regulation is another one of those big topics. However, as a general rule of thumb, prioritize these. Get adequate sleep, supplement with a quality vitamin D supplement, and see a solid wellness provider who can help you reduce inflammatory triggers, as inflammation is one of the main things that leads to immune dysregulation. There you have it, my snappy, free elevator speech guide on what actually causes SIBO and some ways to prevent its occurrence or recurrence. Now, people often think that they have SIBO, but they actually have IBS because many of their symptoms can overlap. To find out how you can tell the difference, watch this video right here. And if you enjoyed this video, we accept charitable contributions in the form of a like and a comment. Hope to see you next time.